And good afternoon to you. I'm Jim Inkster, the moderator, and your number again is 877-217-5757. Much has changed since we last visited with Governor John Bel Edwards a month ago, and of course coronavirus and its impact is defining the nation and the world right now. And Governor Edwards has been a busy man. He had a press conference that was completed about 45 minutes ago, and he is here along with Dr. Katherine ONeill, who is a respiratory specialist at Our Lady of the Lake Hospital in Baton Rouge, where one case is now being treated. There are 257 reported cases in Louisiana, 6 deaths. And Governor, where are we now as far as the outlook for the state moving forward?
Well, first of all, Jim, I thank you again for the opportunity to be here with you and to be able to talk to the listeners around the state. This is obviously a very serious situation. It was just 10 days ago we had one case. And we then declared an emergency. Here we are today with 257 cases, a total of 6 deaths. And really, this is a huge issue around the world, around the country, and we are no exception here in Louisiana. I can tell you we're doing everything that we can, but where we are 2 weeks from now, 2 months from now, 3 months, it depends on what we do in the next couple of weeks. And that is the main point that I want to get in, and you're probably going to hear me say it multiple times. But in the next 2 weeks, and it's not going to be over in 2 weeks, and this fight is going to have to go longer, and these precautions are going to have to be carried out over a longer period of time. But the degree to which we get the cooperation of the people of Louisiana over the next 2 weeks to implement the mitigation measures that we have put in place will determine just how bad this gets. And under any circumstance, it's going to be very bad. The number of cases will continue to increase and probably dramatically in the next 24 to 36 hours not because we have more cases than we have right now, but we have more test results coming in. And so we only say we have a case when we have a positive test result. But these mitigation measures that we put in place, and I know we're going to talk about them here in just a little bit, critically important if we're going to be successful. And I know that we're inconveniencing people, and I know that this is affecting people's livelihoods, whether they're employees or whether they're business owners, whether their money is in the stock market. But this is about the public health and safety of the people of Louisiana. And we always say it because we always mean it. Every government, every governor, that is priority number one. And so we are working hand in hand with our federal partners at the CDC. I've had multiple phone calls with the vice president, with the president. I've had a personal visit with the Surgeon General, Admiral Brett Giroir at the U.S. Public Health Service. He's a Louisiana native. He's in charge of testing for the country. He and I have had an opportunity to communicate several times in the last week. Everything we are doing are practices that they are recommending that we implement, and we have community spread around Louisiana, and these things are just incredibly important. So the big thing is it's going to get worse before it gets better, but we can control how much worse it gets. And if there's any imagery that I want people to have in mind right now, it is what we're seeing in Italy, because there is no reason why that can't be where we are in 2 weeks if we don't do what we're supposed to do. And I know a lot of people assume, well, that's a European country, that's Italy, that's not us. And I hope they're right, and I think they will be right, but only because we're going to do the things that we're required to do in the meantime to try to slow the transmission of coronavirus so that we don't peak too fast and all at one time and overwhelm our capacity to deliver health care. And that's why we brought Dr. Katherine ONeill in here. She is a respiratory therapist, as you just mentioned, and coronavirus in particular impacts those with chronic underlying health conditions in the older population, and the respiratory function is one of those things that's critically important if you're going to gauge how this is going to play out. But there is some small percentage of people across the age spectrum and across the health spectrum who are adversely impacted by this virus. So nobody should think that this doesn't pose a threat to them. And everybody needs to realize that they all have a role to play, because even if they never become symptomatic, they can easily spread this virus once they get it. So Those are the most important points that I wanted to get out early. I appreciate the opportunity to be with you here today and all these listeners. And I am urging, as the governor, that they do what they can to faithfully adhere to these precautions.
Dr. ONeill, why don't you step to the microphone, and you're dealing with this on the front lines. How does it look from your perspective?
It looks like something that we were always told that we would have to prepare for, and now it's here, and all of us have stepped to the plate, which is encouraging. Everybody's made their plan, which is great. And enacting that plan is, I have to tell you, one of the most difficult things that I've ever seen done. And I've been through some tough hurricanes here, and I've seen a lot of people step up to the plate over time, but this is, as the governor said, it's stepping up to the plate for a long period of time. And every conversation we finish with ends with, so what are we going to do in 30 days? And the answer is we may be doing just this again for 30 more days. And being ready for that is hard to swallow. Over at the hospital, we've made significant changes. Patients are going to notice the minute that they walk in, between screening, not allowing visitors, separating people in the emergency department into the sick and the well. Lots of changes just to make sure that people continue to stay safe and separated.
And Governor, in your press conference, you acknowledged that this is likely to get worse before it gets better.
Well, it certainly will. Again, the cases that are positive today were exposures that may have happened 2 weeks ago. And that's why every day, every minute is a minute we can't afford to lose. We know that we have well over 1,000 test results at commercial labs that are going to come back relatively in a tight time period, with some percentage of positives, because these were all symptomatic people. That's why they got their test taken to begin with, many of whom were critically ill. So they're not all going to be positive, but a number of them will. And it's quite possible that we will go from 257 cases to 500 cases in just literally 12 hours, 24 hours. We don't know exactly, but I want people to be prepared for that. I want them to anticipate that. We don't ever want people to panic. But we need people to take this seriously.
Right now in Louisiana, 257 reported cases, 6 deaths, and 597 people tested. So with us to talk about it is Catherine ONeill. Dr. ONeill with Our Lady of the Lake is also at your service if you have a question. And before we go to the phone lines, last night there was a pastor in the Baton Rouge area who defied your order not to assemble in large numbers and did so anyway. Are you concerned that people may go rogue on this?
Well, obviously I'm concerned because, like I said, the most important thing we can do is have everybody. Everybody has a role to play. Everybody needs to abide by these precautions, these mitigation measures. And I'm hopeful that as more information becomes available, as people across the political spectrum join hands and message the same about the seriousness of this situation, that you won't have individuals out there for whatever reason, whatever political persuasion they are, that do this. And really, I'm calling upon leaders, whether they're faith leaders, community leaders, political leaders, education leaders. You saw Coach Orgeron today. Let's all come together and do what is necessary to protect to the maximum extent possible the health, safety, well-being of Louisianans. And certainly we shouldn't be out there encouraging people to engage in behavior that puts them at risk. And I think once we communicate more about exactly what that risk is and how serious the situation is and how critical this time is right now, that we're going to get more compliance. That's certainly my hope, my expectation. So I'm hoping we don't see that anymore, what we saw last night there or anywhere else.
Caleb in Shreveport, you are on the air with Governor John Bell Edwards. Good afternoon, Caleb.
Thank you for taking my question. My question is, as students across the state of Louisiana, public and private, face the possibility of not returning for the 2019-2020 school year, and with your most recent proclamation calling on Bessie to suspend LEAP and attendance requirements, of course with a federal waiver, how will students be prepared for grade readiness going into the next fall 2020 school year after missing a quarter of classes this current school year?
Yeah, well, that is a great question, and it's going to be very difficult. We know that the Department of Education, the Bessie Board, all of our school superintendents, school boards, school districts, teachers, principals, they are intensely focused on that particular question. But at the end of the day, if for some protracted period of time kids are not able to go to school, parents and caregivers are going to have to step up and make sure that they are communicating with those schools, looking at all of the distance learning that they are attempting to put in place, engage with educational broadcasting coming out of LPB. There are a number of things that we can do, and none of it will make up in total for the fact that they're not in school, but we can minimize the disruption that our students are going to face. But it's going to take everybody working together to do that. We're encouraging people to be patient. And by the way, we have many requirements related to LEAP testing, attendance, assessments of schools and letter grades and evaluations of teachers, you name it, that are all part of our agreement with the federal government under the Every Student Succeeds Act. So they're both a statutory requirement in Louisiana, and they're a requirement because of ESSA at the federal government. So that's why we have to pursue a waiver from the federal government. At the same time, I suspend the statutory requirements in Louisiana, and my suspensions will only be valid and effective to the extent that we get the waiver. Now, we believe we're going to get the waiver, but we need people to be patient, do everything that they can as individuals, and understand that quite frankly, we're going to do the very best we can. State government is not going to be able to solve all of the problems that people are going to have, and we need people to exercise their own initiative and minimize the disruptions and so forth that they're going to experience. And I think the education of our children is part of that, although our school districts, our education community, are working very, very hard.
Linda in New Orleans. Linda, good afternoon. You're on Ask the Governor.
Oh, thank you, Jim. Hey, Governor Edwards.
Hi, Linda.
I'm very grateful that you are our governor at this moment. I did want to ask you about we've postponed this April 4th election, and as you've pointed out several times, we don't exactly know what the course of this pandemic is going to be. So I know a lot of people are worried about not having the opportunity to vote. Is there some way, since we are in a state of emergency, that you can trigger a way for people to have no excuse vote by mail? I'm for doing that permanently, but in the meantime, is there a way for us to do that this year?
Well, Linda, as you know, the chief elections officer in the state is the Secretary of State. He and I had a brief conversation about this. I can assure you and all the citizens of Louisiana that he is looking at every possibility so that we can have this election. First of all, the one we just suspended that was going to happen in the March-April timeframe, and now will happen a little later, but that we can have it in a way that doesn't enhance the risk to the voting public. And mail is one of the things he's looking at. There are serious challenges, as you can imagine and appreciate, when you radically change the manner by which you vote and the amount of time that he would have to get that done. But he is looking at that and some other options, and he and I are going to meet soon to see what that looks like. But voting is obviously critically important. This is an election year for president, and this typically is when the most people in the country exercise their right to vote. It's critically important. We also have congressional races up and so forth. So we're going to do it, but we're going to do it in a way that to the maximum extent possible protects the health and safety of our people.
James in Longview, Texas. Hello, James. You're on Ask the Governor.
Well, hi, Jim, and hello, Governor, and hello, Dr. ONeill. Anyhow, basically, I know you're overwhelmed with this COVID-19 crisis, so I'll just keep a comment, really. My prayers are with us all, and I'm just kind of wondering about the daily communications between any given state and the CDC. Can you just kind of tell me and all the citizens, is it kind of a collective communication, or you mentioned the vice president calling you? Can you just say if it's individualized or more collective?
Well, first of all, it is every single day, and with a variety of federal partners. So the vice president, as you probably realize, was tasked by the president with leading the White House task force to respond to this novel coronavirus, COVID-19. And part of his team consists of the U.S. Public Health Service, the CDC, the EPA, Dr. Tony Fauci, who directs the Center for Allergy and Infectious Diseases, and that's probably not the exact name, but all of these people are making themselves available, and of course not just themselves, but their entire teams, and the communication is pretty good. But the facts are changing, and this is not a virus. I mean, they call it a novel coronavirus. It's new. They have limited knowledge about it. They are learning, and they're learning at a fairly rapid rate. But they're giving us the very best guidance that they can, based on their understanding of this virus and their education and their training and their experience and so forth. And the communication really is pretty good. And I think that that's essential, because I think now you have no disagreement in the messaging coming from the White House to any governor's office, hopefully to any mayor's office and so forth. And now we're going to be able to really lock arms in a figurative way, because we're not going to touch one another, and respond in a comprehensive and effective manner. But the government can't do this. We need people to do this, and we need people to really practice all of the mitigation measures that we put in place. But that's a great question, James.
Thomas in Pineville. Hello, Thomas. You're on the air with the governor.
Hello, Mr. Governor. How are you doing, sir?
I'm doing fine, Thomas. Thank you.
I was just curious if you're going to be extending the state income tax deadline from May the 15th, particularly for those that may happen to owe state taxes and will be able to pay those at that time.
Yeah, so we typically act in concert with the federal government, and we don't want to message before they do. As you know, our federal income tax deadline is April the 15th. We're 30 days later on May the 15th. And so we want to make sure that we're messaging consistent so we don't unnecessarily confuse people. And you're going to be hearing an announcement about this very shortly, because obviously we need to be responsive, and we're trying to get our messaging in sync. But it's my expectation you're going to hear something very soon.
This is relatively new news. The IRS has extended the federal deadline till July 15th. So
yeah,
so we're going to have some extra time.
Yeah, there'll be extra time for the federal tax filing date, which is now July 15th, and you will be getting information from us relatively soon about what our deadline is going to be.
Mallory in Slidell. Mallory, you're on the air with Governor Edwards.
Hi. So I went grocery shopping for the first time yesterday, and I kind of thought up to that point that, panic buying is kind of a joke. The things that I saw on social media wasn't a thing, but I was actually really startled as to how little groceries there were, how few cleaning supplies, basic hygiene supplies there were. So my question to you is, what can we as a community do to help mitigate the spread of panic, and especially in terms of panic buying of all sorts of resources, not just food, but also hygienic supplies as well?
Mallory, thank you for the question. And this is part of being a good neighbor, and it's something that's really important. The president spoke to the governors about this, as did the vice president. All of the major grocers have come online and said there is not a problem with logistics. There is not a problem with being able to resupply. The wholesale operations are running just fine. But at retail, that you have people who are going to the store and they're buying for maybe a month when they should be buying for a week, as they normally do. And so you're going to see stores that reduce their hours. It's not because they don't have material to sell. It's because they have to clean more frequently and they have to restock more frequently. But I'm hopeful that this is going to kind of reach its equilibrium and people will calm down. But in the meantime, we are encouraging everybody to buy only what you need. Shop for a week. Don't shop for a month. And we have every reason to believe. And both here locally, we've talked to the Louisiana Department of Economic Development has talked to a number of local grocers, in addition to the big fellas like the Walmarts and the Costco's and the whoever, Dollar General. This is all going to work. We just need to relax and buy what we need for a week at a time.
Lines are busy, but we obviously are talking to people, and we'll get to as many of you as we can in our remaining half hour. Governor John Bel Edwards in his 48th consecutive month of doing this program, and with him is Dr. Catherine ONeill, a respiratory therapist. And Governor, I know there has been some news made within the last few minutes regarding another reported death.
Very sadly, I learned from the Department of Health just a few minutes ago that we are now reporting our 7th death, and this is an individual out of Jefferson Parish, and I don't have information about age or anything like that, whether the individual had chronic underlying health conditions or so forth, but certainly our condolences go out to that family, to that community, and all of this is sad. It's tragic. Unfortunately, I believe we're going to see a lot more of this before things get better.
Dr. ONeill, as a specialist in this area, which is the area that people are afflicted with when they get coronavirus, how concerning is it for the people who are handling the cases? You obviously are at risk yourself.
The area of infectious diseases, we spend our lives ready for a pandemic, right? And you're never ready, because the feeling of fear when your life is at risk by caring for someone else is not something we tackle in the medical field very often. What we do know is that we deal with the flu every year, and coronavirus is a droplet spread organism. Mm-hmm. So going back to the basics of what we know has really helped our healthcare workers. We practice that every year, and we preach it every year. So it's not something special. We don't have to do anything different at work. We have to be very deliberate about our work, and that's why we are there when healthcare workers go into the room. We spend hours a day re-rounding in those areas that have these patients to make sure that everybody's ready, everybody's acting deliberately. But really the key to success is doing the things you know how to do well. We're going to say it again, washing our hands, not touching our face, wiping down shared surfaces. We do all of those things in the hospital too, just like we're asking people to do in their homes, because doing those things saves lives.
You have been doing this a while, as you stated, and this is certainly a new terrain we're dealing with, but it's work that somebody has to do, and it takes a special kind of person to do it. I know the governor brought you here for that reason, and that this is a time in which we're challenged, but most people, as we know, will survive this even if they get coronavirus. How important is it to, beyond taking the precautionary measures, to try to stay in reasonably good shape? You know, now we're not going to be going to the gym. What can we do to try to thwart this if it lasts for a while?
Right. Coronavirus is a virus that primarily affects your respiratory system. So it's a virus that we used to see in kids. It causes the common cold as well. But in this virus, it's going to attach to the deeper parts of your lungs and cause pneumonia. I worry about all of our chronic lung patients. We see a lot of chronic lung patients in the infectious diseases clinic and then in our pulmonary clinic, making sure that you're following up with your doctor, that you're calling right away if you don't feel well. It's allergy season. We don't want that allergy season to exacerbate your symptoms and then you not have the medicines you need to get over that. So I think that while we're instructing people to stay home, we don't want you to not call. We want you to call, make sure you have refills of your medicines, and that you're keeping up with your respiratory health.
877-217-5757 is your number. Nancy in Lake Charles, you're on the air with Governor Edwards and Dr. ONeill. Hi, Nancy.
Hi. Yes, I'd just like to echo again Linda's comment about how good this governor makes us feel with what's going on. But the main reason I called in is I was watching a Lafayette news station yesterday, and Lafayette is starting to test at the Cajun Dome. However, what concerned me, they said if you did not have insurance, the test was going to be $50. And I'm not concerned from my standpoint. I'm on Medicare. But I'm concerned about it from a community standpoint of the people that we know. There are many in this state that $50 is a lot. So I don't know whether there's something that's going to address this. I thought I had heard the federal government say the test would be free. So I'm just trying to see if we all know what's going on.
Nancy, thank you for the call. And you did hear correctly. That is what the federal government put out, that people, whether they are insured privately, whether they have Medicare, Medicaid, or they are uninsured, that they were going to make sure that testing was available at no cost to the individual. That's the first that I've heard that there's $50 charge being levied in order for people to access testing over in Lafayette. It is a good thing that our testing capacity is growing, and that the throughput of our labs is increasing, and that we're bringing more labs online, because the truth is we can't know what we're dealing with if we don't know how many people out there have it and how fast the transmission rate is increasing. But I will engage on this as soon as this program is over. In fact, I have my staff listening to it right now. They will call and try to make sure that we get to the bottom of this, and we want to make sure we're communicating effectively as to who can be tested there, what they have to do, whether it requires a doctor's order and that sort of stuff, and then the priority of testing and whether or not a payment is required. And we'll get on this right away, and I thank you for bringing it to my attention, Nancy.
Sean in New Orleans. Sean, you're on the air with Governor Edwards.
Hi, yeah, I'm a performer, and I play music here in New Orleans and work on the American Queen cruise line. And during the next 3 or 4 months, I make more than half of my yearly income, being that this is the peak of the season. And as a self-employed person, we don't even get employment insurance. Is there a plan for folks like us?
Sean, thank you very much for the call. And you're not alone. There are a lot individuals who are not employees, but if they're self-employed, there's nobody paying into the unemployment insurance fund for them, and therefore they don't have benefits to draw in situations like this. And by the way, this is particularly bad for our economy, as it is for around the country, because tourism peaks during this time of year. We have 400 festivals that drive tourism and spending, and this is the time when restaurants make the most money, and therefore the people working in the restaurants make the most money, and so forth. And so obviously we're going to do everything we can to help. But what's going to be available to you is whatever is going to be passed to address this specific situation. So I encourage you and people like you to monitor what Congress is doing. And I believe the U.S. Senate is set to vote today to pass the relief bill that the House of Representatives passed on Monday. And so I would encourage you to, once that vote happens and it passes, take a look and see what they might be able to do for you. And I know that there are additional relief packages that are still being formulated. They're going to come out of Congress over the next days and weeks. And so look for those as well. Oh, and we're going to do everything we can here at the state level to administer those programs just as quickly as we can. I know there's some talk about mailing checks directly to individuals. I don't have any promise that I can make on that level, but I know that Congress is working on that. But I would encourage you, generally for those people, well, we're asking everybody who has been laid off and could potentially qualify for unemployment benefits to go ahead and file that. So we're waiving the waiting period for receipt of benefits, and we're waiving the search requirement that you typically have to engage in. And I know that I may not be talking directly to address your needs, Sean, but if I didn't get another question on unemployment, I felt like I needed to address it right there.
Barbara and Zachary. Hello, Barbara. You're on the air with the governor.
Hi, Governor. My question concerns the work from home option that I think that you have asked a lot of people to pursue. And I don't think that all of the state offices are actually following this very well. And I'm wondering if there's anything that you could say to your directors or whatever to encourage them to do this.
Thank you, Barbara. And we've done that. We're going to continue to do it. So we have some essential functions that the state government has to perform, services that we have to deliver every day. And many of those quite simply can't be done at home. So those individuals are going to have to go to work. Secondarily, we have some individuals who can work from home, and they have everything that's required to do that. And we've encouraged every cabinet secretary, every agency in state government to make sure that we're maximizing the number of people who are given the opportunity to work at home. there are some state workers that just don't have that ability, and we're trying to ramp up the capacity to work at home as quickly as possible by making more computers available, for example, so that they can telework. I think that's what we're calling it, telecommute, telework. But we are working on this as quickly as we possibly can.
We did want to talk with him briefly about how this affects the budget. Obviously, these are challenging times not only for people's health, but also for finances, and the economy is roiling as a result of what is happening with coronavirus. Oil prices have tumbled below $25 a barrel. Governor, what do you think as far as how this will affect the Louisiana budget?
Well, just like it's going to affect the revenue that the federal government gets and state governments, it's obviously going to be adverse. We are asking our economists who work for the division, who work for the legislature, to really engage in this right now, because we do have a legislative session ongoing. I know that they have recessed until March the 31st, but we do have to have a budget in place before July 1st, because that's a new budget year, and our budget authority ends on June 30th. So we're going to have to work through this process. We will go, it's the same process, it's just the numbers are going to be different. We're going to have to get an REC forecast. That limits our authority to spend and to budget to. And quite frankly, right now, I don't have a prediction on what that's going to look like, other than both for the remainder of the current year and for next fiscal year that starts July 1st, those revenue numbers are going to be down. And therefore, we're going to have to adjust our budget, because unlike the federal government, we are obligated under the Constitution to deliver a balanced budget every single year.
The federal government, though, there are estimates now that it could be $2 to $4 trillion in the red. Now, that's a huge number, but it may very well be the case with the stimulus plan the president is proposing, and Congress will likely okay. But as you state, you've got to have a balanced budget, and if you don't have enough money to provide services, what are the options?
Well, and this was a major topic of the call I had today with the National Governors Association with other governors. We're trying to make sure that congressmen and senators and the president understand that, and I think it's the case for just about every single state, we have balanced budget requirements in our state constitutions. And so as they look at making assistance available, that they keep that in mind, and that to the extent possible, federal funding may be made available in a generous capacity, but would also without a lot of strings attached, so that we have maximum flexibility, because all of our needs are going to be a little bit different. But, you know, I am worried about the economy. I'm worried about jobs and so forth. I'm just reassuring people that we're going to do everything that we possibly can, working with businesses, working with nonprofits, working with local government and our federal partners to take advantage of every opportunity that we have to deliver assistance and relief, and that we're going to get through this. And it's not going to be any fun, and it's going to take longer than we want it to take, but we are going to get through this.
Nick in Baton Rouge. Nick, you're on the air with Governor John Bell Edwards.
Thank you so much. First, Governor, thank you for the tremendous job you're doing. And I am curious, you were an Army Ranger, and Army Rangers are trained to do a lot of things. And one of the things they learn is speed can be your friend. You have reacted and led quicker than others. Is that a result of your Army Ranger training? I mean, is this something that you've always realized, that the faster you move, the more effect you can have, even if there may be a mistake along the way? Speed is your friend, and is that why you've been so proactive?
Well, Nick, I do believe that we're all a product of our experiences and our education, our training, and so forth. So I can't distance myself from that. I was taught at West Point and in the Army that you have to make the best possible decision you can, but you cannot wait until you have perfect information, because if you do, you're going to wait too late. And that is especially the case on a pandemic, because if you just look at the numbers today in terms of cases, we know that the actual cases out there, the ones tested and untested, are much, much greater. And so you have to move fast. You have to try to get ahead of it as best you can. But quite frankly, this was also the guidance coming from the CDC. It was the guidance I got from the Surgeon General last week when Dr. Jerome Adams came to Baton Rouge and sat with me in the office and talked me through this. This is what I got from Brett Giroir, and I'll look at what Tony Fauci is saying every single day. So we have to act, and we can't wait till we have perfect information. We have to get as far out as we can in advance of this. We have to increase our surge capacity, even while we try to reduce the demand on our medical facilities. And I've got a legislature that's not meeting, and so we're working through this, and we're gonna do the very best we can, and we're gonna learn a lot of lessons. There's no doubt about it, because we're gonna make mistakes, but we will make mistakes of commission, not mistakes of omission.
Jack in Baton Rouge. Hello, Jack. You're on the air with the governor. Hi, Jack. Oops, excuse me. I think I hit the wrong button.
We
Jack, there you
pay
go.
the highest.
Go
Can you
ahead.
hear me?
Yes.
Okay. Yeah, so I'm a PhD student at LSU, and we pay the highest fees out of any school in the country. And with the virus going on, it kind of brings to light that LSU, unlike many other top schools, doesn't offer us health insurance. I was wondering to see if you knew about that or had any opinion on that.
Jack, please stay on. Let me ask you this question again, because you were starting to ask the question before you actually were connected to my headset, and so I need you to say it one more time if you can.
Well, I was just wondering if you were aware of that situation with us paying the highest fees in the country and LSU not offering us health insurance, especially given the typical workload and how that's kind of common for most top schools in the country now.
And where are you going to school?
LSU.
Okay, so Jack, it's my understanding you're at LSU. You're a PhD student, and you're paying fees to LSU as a PhD student, but at the same time you don't have health insurance. Yeah, that's not something I was aware of before today. Obviously, we'll take a look at this. Hopefully, you do have access to insurance, perhaps through the exchange. I'm not sure of your personal situation. And there's nothing I'm going to be able to do in the near term, I suspect, to remedy that. But now that you brought it to my attention, I will get with the folks at LSU and see if this is a problem across the state as well.
Thank you. Nita in Paradise, Paradise, Louisiana. You were on Ask the Governor. Hi.
Hi, Governor Edwards.
Hi, Miss Nita.
This is Nita Oliphant. I was wondering if the president made it, and you said you had been in touch with the president, but is the $1,000 going to include the elderly people who are on Social Security or retired fixed incomes?
Ms. Nita, thank you very much for the call. At this point in time, I think that's going to be decided by Congress that are taking up the legislation. I heard Steve Mnuchin, the Secretary of the Treasury, say it was his intention that within the next couple of weeks to get checks out to Americans. Exactly which Americans and how much, I don't know, but I'm going to urge you to continue to monitor the situation, watch the bills as they're passed through Congress. And it was just as recent as yesterday that I actually did have a conversation with the president. I wasn't asking him about this specific matter, but I do appreciate the fact that the president took time to allow me to express what our biggest concerns as a state in responding to the coronavirus crisis has been.
Michael in New Orleans. Hello, Michael. You're on the air.
Hey, Jim. Hey, Governor. Thanks for taking my call. I'd like to reiterate what the other guy said. I appreciate your leadership and those tough decisions you made early on. The numbers are certainly proving that they were wise decisions. So I work in the medical field, anywhere from central, southern, and Louisiana and New Orleans. And I work at some ambulatory surgery centers, and we're still doing a lot of elective surgeries. I know the Surgeon General has recommended that elective surgeries be canceled. I kind of feel bad that a lot of elderly patients coming in, a lot of the potentially crucial supplies we may need in the future are being used up for elective surgeries. And I'm hearing from some places, at work that they're not going to stop until there's some kind of mandate. Is your administration thinking about placing some kind of mandate on elective surgeries?
Well, we haven't done that. We have requested through LDH to our providers that they stop elective procedures. It's come from the Surgeon General of the United States and so forth. I'm going to ask Dr. ONeill to address this.
Thank you for the question. I think that over the past weekend, the American College of Surgeons was very clear that they wanted hospitals to start limiting the amount of elective surgeries, and followed by LDH today. Actually, just when I left the office, I saw that memo come across from LDH telling hospitals that it was time to start canceling elective procedures and unnecessary procedures for the next 30 days. And that was the language. And what that does is it gives us time to look at our schedules and decide who needs surgery. If you're a cancer patient and you need a biopsy so that you can start chemotherapy, if you have an aortic aneurysm and you're scheduled next week because that aneurysm is getting too big and it's time to correct it, those are not elective procedures. They may be scheduled procedures, but they are procedures that are critical to life and that we're going to proceed with. But if you have something that can be put off for the next 30 days, that's what the Department of Health has asked us to do, and we will follow suit.
And I'm getting the cue that it's time to call this a show, but the governor will be back in 4 weeks, exactly 4 weeks from today, and hopefully, Governor, I know you hope there will be progress, as we all do.
Well, I can assure you that it's going to be a tough 4 weeks, and I'm asking for the prayers of the people of Louisiana.